Hello guys, today we're going to be talking about the cures for maclusion. Um, Specifically the two main ones, which are orthodontics and orthotropics, and what they do right and what they do wrong, and what needs to actually be fixed in order for maclusion to be prevented. Okay, so I'm going to go over the current treatments for maclusion that at least I know of. And those two options are orthodontics and orthotropics, okay? What is orthotropics? Orthotropics was basically created by John Mew like 75 years ago, or I don't know, but it was created like some time ago. I'm gonna go over that next, but essentially, it's a branch of dentistry that ideally prioritizes forward growth. As seen here, it basically just promotes growth, and that's great. That's awesome, right? Ideally, orthotropics, theoretically, if they follow this and it's legit, there should be no issues with the orthotropic movement. However, there are numerous issues with the movement, which I will talk about next. Orthotropics, as of now, it's just kind of a mess. So yeah. Orthodontics. Basically, your current maclusion treatment, braces, retainers, all of that. Orthodontics. There's also numerous issues with orthodontics. Mainly one of those being that it doesn't actually fix anything, it's just purely cosmetic. I mean, obviously, it's advertised that, it fixes your oral health. Which, sure, I mean, it does, but if oral health means relying on a retainer for life, yeah, man, I don't think so.
In effect, what we do differently is to change the face to fit the teeth, rather than the teeth to fit the face.
Okay, there you have it. That's essentially the principle of orthotropics. And if you watch my previous videos, you'll understand that, that's ideally the correct way to fix maclusion. Because so the main issue with the orthotropics movement is that there's a lot of misinformation. Created by the founders, actually. So if any of you don't know, y'all know what mewing is. Okay, the thing with mewing is that mewing is basically your natural tongue posture that's being made by just like nose breathing, pretty much, and by closing your mouth. But this guy advertise it like it's going to be a life-changing thing, and I'm going to change my jawline or whatever, or make my palate wider. Like, that's not going to happen because, first of all, there's no studies that even talk about it. Like, if you look it up, there's like 0 studies. Like, I'm talking about none. Okay? Like, look, he's going to talk about, look, you go on Shorts real quick. Look, I'm just going to search it up, like. I'm searching it up right now. Right?
Science behind mewing. Ever wondered why mewing works? How it can enhance your facial structure? And the science behind it. Let's dive in. Meet your maxilla, upper jawbone, the seat of facial beauty. by applying proper tongue posture, up, forwards and outwards, consistently over prolonged periods, this bone can move. The sutures of the top jaw are designed to allow this bone some flexibility. Understanding mewing is understanding how these jaw bones moved, and it can unlock the full potential, gaining more confidence, a balanced appearance. And if you're ready to harness the power of mewing, download the mewing app.
Okay, so this is complete horse shit because okay, here there's two problems with this. First of all, there's no studies. I'm gonna show it to you. Studies on mewing. Go here. Conclusions. So, okay, so basically there is little evidence there. Okay, first of all, if you read this, the systematic review assessed on the current literature. Several studies demonstrated muscle tone. Yeah. Okay. First of all, there's nothing on the palate. I'm just gonna say this. However, it's limited by small sample sizes and like outcome measures. Okay. So the problem is that, first of all, if you go to the discussion, like you see, there isn't really like yeah, this is going over like facial rejuvenation. Like this isn't even like an article talking about mewing basically. Does mewing actually reshape your jaw? This is not even a scientific article. What, Cleveland Clinic? That's a good one. That's a really good one. Yeah, yada yada. Does it work? This mewing isn't specific or strong enough to really change much of the facial features. Okay? But then, this guy, right? He's the founder of orthotropics, okay? And he has a lot of good ideas. But he basically just stays relevant by spreading misinformation and not backing up his sources. Because I'll give you another example, okay? Another common practice done by orthotropics, it's called thumb pulling, okay? Does it yeah, like,
can you make a video about thumb pulling? Is it effective or not? Yes, we're going to do this. That's something I really want to do. So I think thumb pulling could potentially be really effective, and I really want to explore that rabbit hole in great depth, and I want some people to come forward who are going to offer to help me get down that rabbit hole and get the answers. And I'm here to learn. I think there's lumps of gold lying around on the ground, and the profession's walking around like this. We don't want to look because...
Okay, that wasn't a good one, but hold up, I'll find it somewhere. 8 months, 7 months. Okay, this is more recent.
Okay, so what is thumb pulling? This is trying to do this at home using your thumbs to try and manipulate your skull. And I kind of, this idea of doing something yourself on yourself and doing it regularly at home, it rings a lot of sensible bells with me. You know, a lot of experience I've done through various different treatments where you go to see a professional once or twice a week, in comparison to when you're doing something yourself every day, and even more than that, when you're doing it upon yourself and you get some sort of personal feedback that a practitioner it would never be quite the same if you had someone doing it for you. The idea is, basically, I believe, and I've not really done a deep dive yet, is holding the side teeth between your fingers and thumbs and gently trying to manipulate this. And in theory, you should be trying to manipulate this with the cranial rhythm that's already going, trying to slowly magnify it, if you will. I'm interested in whether it would be the tongue would actually normally drive this rather than thumbs. Clearly, thumbs are what we're going to do in thumb pulling. It's the whole name of it, thumb pulling. So what you're doing some artificial assistance of what would happen naturally. So now, the cautions that I've gleaned so far would be potential damage to the teeth or the gums because you're putting pressure on them. If you've got loose teeth, that could be a real risk. Or if you've got, please be aware of that as well. And what I noticed going through these comments is that some people
Okay, so look, I'm not even going to finish this. You know, I'm going to finish the video.
claim to have gained asymmetry. Now, clearly, it's one of the things that I've said out loud that I'm cautious about anyone with asymmetries. Really, we've got to start from the ground and work up. And asymmetries in the cranial structure are incredibly complex.
Okay, so
what?
This is another one. It's like this guy is like talking about thumb pulling, and it doesn't work because first of all, there's no studies on it. Okay, there's zero studies. I even made a comment like, wouldn't it cause asymmetry? This seems like a very reckless. There's no proof that it works. Oh, it actually will work. And if you don't do it properly, you create asymmetry. It's like, no, you won't. Do you not understand how bone modeling and bone remodeling work? Okay, look, maybe if you do it when you're a kid, sure, maybe. Okay. But first of all, it's done by yourself, mind you. Like, a practitioner isn't even doing this practice. Second, even let's say if it did work, at best, you don't mess up your jaw, and at worst, you like screw up your teeth and gums, as he did mention in the video. So I will give him a pass for that. But this is the type of thing that's plaguing the orthotropic movement right now. And look, I would even go as far to say, as this guy, okay, Mike Mew is controlled opposition, okay? Because literally what he's doing is he's basically, he originally created a really good concept, but the problem is that he just stayed relevant through like internet trends and he just lied to people. And then he even lost like a court case recently because he just spewed a bunch of nonsense, right? That's not accurate. And if you really want to actually like prevent malclusion, all you have to do is just chew tougher foods throughout your life, right? If you want to prevent, I might have said treat. If you want to prevent malclusion, you make children eat harder foods. That's all you have to do, right? And that's what I was proving to you guys in my earlier videos. With evidence, by the way, with articles. But this guy doesn't have any of that. And his techniques that he uses aren't backed up by a lot of science. And if there is any science, he's not referencing it at all. So, like, why should I trust this guy? Okay. So anyway, that's my 2 cents about the orthotropic movement. If you guys have any, like, questions about it, hit me up in the comments. But yeah, there's just zero evidence proving any of this. Let me see if I can find other examples. yeah, like looks maxing, like it like devolved into just internet culture, which there's some truth to it because, like the reality about looks maxing is that that's how you breathe better. Okay, I'm going to go over that in another video, but that's super important for like nasal health and like nose breathing and things like that. And it just became more aesthetics based than like maclusion based, right? Anyways, yeah, that's my 2 cents on the whole orthotropics movement. Okay, so orthodontics is the orthodontic industry. It's obvious it does absolutely nothing for maclusion. Okay, and I'm going to tell you why. So you would think that, maclusion would at least like, because maclusion, right? Okay, what is maclusion? Malocclusion, often referred to as a bad bite, is a medical term for misaligned teeth and jaws. It occurs when your upper and lower teeth do not fit together correctly when you close your fucking mouth. Okay? Types of malocclusions. Look, if you don't even believe me because it is AI, fine. We'll go to Boston, we'll go to childrenshospital.org. Yeah. Symptoms and causes. Malocclusion refers to any degree of irregular contact with the teeth of your child's upper jaw with the teeth and lower jaw. This includes overbites, underbites, and crossbites. This is both crowding of your child's teeth. Okay, great. So you would think that the orthodontic industry cures that. It's almost like they advertise it, diagnoses and treatments. All right. This is talking. Usually, the Children's Hospital usually talks about extreme cases. Oh, wait. It's almost like they advertise dentistry and orthodontics. Okay. So here's the problem with orthodontics. It does absolutely horse shit nothing for malocclusion. And I'm going to go over 2 studies to show you why. The association between orthodontic treatment and third molar position. Basically, wisdom teeth, okay? So you would think that, orthodontic treatment would, like, I don't know, maybe help people, right? Maybe if it's malocclusion, right, they would try to make them grow in properly. Oh, nope, they don't give a fuck. The conclusion is the significant outcomes indicate that orthodontically related treated patients may develop higher likeliness to partially erupted third molars, which leads to a local clinical morbidities. Yap. Basically saying that there's a higher chance for wisdom teeth, which are third molars, by the way, orthodontics essentially increases the risk that happens. Okay, but sure, at least my teeth are all good now and they bite properly. Oh, great. It gets worse. Association between orthodontic treatment and the occurrences of temporal mandibular disorders. So this is like TMJ, all right, jaw issues specifically. Okay, let's go to the discussion because I'm a chud and I'm not going to read the whole study. Let's go to the discussion and conclusions. Okay? Oops. The aim of this systematic review analysis was to determine the association between orthodontic treatment and the occurrence of TMJ. The results revealed that there's an association between the two of them, and the grade analysis shows a high certainty. Okay, however, possible negative effect of orthodontic treatment on the joint has been a matter of concern for orthodontics and dentists in general. However, the evidence isn't clear and is mainly accepted there's no such relationship. Several researchers considered that dental interventions, including orthodontics itself, may cause TMJ. However, on the other hand, the difficulties are quite significant. In contrast to findings... Okay, so they're basically saying that, in a nutshell, there's a lot of debate around whether it causes, freaking jaw issues. So you're telling me that if my child goes through typical orthodontic treatment, that they're at risk for freaking whatever you call this. Well, I know what this is. This is like TMJ, TMD. So jaw, joint issues. Okay, they're at risk for temporal mandibular disorders. Like, are you freaking kidding me? These people have zero clue what they're doing, okay? And I could get like a lot more articles, but these are just two examples of why orthodontics does absolutely nothing for you, and it's purely cosmetic and doesn't fix anything. And the thing about orthotropics that gets me like so mad sometimes is like, obviously, it's just that like there's so much good information in there. Like, this guy is talking about like, chewing hard foods when you're a kid, and like understanding the how your palate and your jaws connected to everything, and how it's like preventative treatment and making the jaw bigger by wearing palate expanders. Like, this guy is saying so much good information, but there's so much glaring problems that he just doesn't address, and he just makes the concept of orthotropics so overcomplicated. Right? Like, it's like the movement, there's so much good information in the orthotropics movement. You just have to, basically, if you want a good rule of thumb for if believing anything about the orthotropics movement is, if there isn't a study, don't listen to it. Alright? And like a lot, like also, like the chewing hard food stuff, like I proved that to you. I used evidence. This guy is not really using that much evidence, and it's just overcomplicated. He doesn't really link a lot of his like ideas back to like the main core concept, which makes it really hard to track where he's at and like how this relates to overall like overall cure for malocclusion, if that makes sense. Like, what I mean is that he says, oh, mewing is this, and then, oh, thumb pulling is this, and then, oh, wear a palate expander for this. But like, how does all of that relate back? And that's kind of what the orthotropics movement is really struggling with right now. But yeah, man, the concept is awesome. Like, forward growth, like, I'm all for it. Making your wisdom teeth grow in because your jaw is actually big enough to make them grow properly. Like, sign me up. Anyways, so basically what I was talking to you about can be summarized by this. The two main treatments for malocclusion are orthotropics and orthodontics. Orthodontics is traditional malocclusion treatment. Alright, does nothing and is mostly horrible. Orthotropics has the right idea. However, a lot of the movement gets relevance from internet trends, which as a result yields a bunch of misinformation. However, the concept of orthotropics is amazing. And yeah, that's just my 2 cents about this whole thing. Thank you for listening. If you have any questions, comments, or concerns, leave a comment in the description below, or whatever. Just comment on the video and ask questions. I will answer them. Thank you so much, and have a great rest of your day. God bless.